At this point, we're moving on to the 6th phase of your rehab program that you can perform at home, recovering from your shoulder surgery. Here we're really talking about a phase where what was fixed surgically should be pretty well healed up. Your motion should be pretty good. You're starting to build on your strength. Really talking at about 16 weeks or so out from surgery. Could be a little sooner or a little later depending on exactly what you had done. And again, this should all be run through your surgeon. As part of this, what I would say is you can continue with the stretching exercises in the earlier phase. And as we went through phase 5 with you, where we did some strengthening, initially you're going to be doing those phases with your arms down low. You gradually work up higher, but you can continue to increase the resistance you get from those bands, where it really can be a pretty good workout that you can continue on through. Now, as we're moving into this last phase, it's really a functional rehabilitation phase. So now we're trying to build on that strength, and we're trying to develop your core strength and muscles to get you back to whatever activity you want to get back to. That can vary from person to person. You might be a golfer, sprinter, you may run marathons, swimmer. Depending on what you go back to, it's going to be a bit different on what that phase is, and it's impossible to go through all that during this video. But what I would say is you want to consult with your surgeon and come up with a sports-specific plan that will really take you from the 4 months to the 6 months, even further out until you get back to doing exactly what you want to do.
So in phase 6, we have some more functional exercises as long as you have the clearance from your physician. And we'll start with planks here. And what you can do is make sure you can start on your knees and pulling your belly button toward your spine to work your core, making sure your shoulders are feeling comfortable in the position that they're in. And as you feel more comfortable and stronger, you can get up onto your toes. Again, trying to keep your core engaged, pulling your belly button toward your spine and making sure that the shoulders are feeling comfortable. Then the next exercise is moving toward side or lateral plank. And again, you can start on non-surgical side and then move to surgical side as comfortable, starting on your knees for the initial phase of this exercise and pulling again your belly button towards your spine. And as you get stronger, you can move on to your feet. And again, holding your belly button toward your spine, making sure the shoulder is feeling comfortable, whether you're on your non-surgical or your surgical side. So if you get into your push-up position, you can start with, again, on knees if it feels more comfortable. You want to make sure your shoulder is in a comfortable position, and when you're coming down, again, into a range of motion that is tolerable to the shoulder, the surgical shoulder. You can also go into, as you feel stronger, into the full push-up position, and then coming down, holding again your core, making sure the shoulder feels comfortable. You can also do a push-up with a plus, where we're also using some protraction and retraction into the shoulder girdle as well. All right, in this phase 6, we have some more functional exercises that you could try at home if you have a Swiss ball. So the first exercise being what we call stir the pot. You're on your knees, you're leaning on the ball, and again, you're up onto your elbows, making sure the shoulder is feeling comfortable, and you are just leaning onto the ball and going in circles. You can move clockwise and then move counterclockwise as it feels comfortable. Then another exercise that you can do is what we call ball walkout. And so you're just coming out forward, again engaging the core, making sure your shoulders feel comfortable as you're doing so. You don't want to have any pain in the shoulder while doing this exercise. The next functional exercise in phase 6 is using a dodgeball. And you can be throwing right at chest level to start with and bouncing off the wall, making sure the shoulder is feeling comfortable again. And you can slowly move up into the position overhead and working in overhead positions. and moving up and down as feels comfortable. As you progress the exercise, you can also add a medicine ball as the strength increases, and moving again up and down, starting first with 2 hands, then you can start working with 1 hand as well, doing the same thing.